Hi, my name is Bondurant, and I'm a visiting assistant professor in philosophy, as well as philosophy, politics, economics, and law at University of Richmond in Richmond, Virginia. I'm here to talk about medical gaslighting, self-knowledge, and epistemic injustice. In the US, Black women and people who are pregnant experience some of the highest rates of infant and maternal mortality in the world, even when controlling for factors such as social economic status. This serious danger is finally getting medical and mainstream attention. Celebrity Serena Williams has spoken out about her own experience of being ignored and dismissed. And the recent Hulu documentary Aftershock explores this epidemic. Philosophically and ethically, we should care about what is happening, the causes, and the implications for other forms of dangerous discrimination. The term gaslighting has become increasingly popular in both academic and public conversations. Gaslighting, if successful, results in distorted memories and self-doubt of one's perceptions, experiences, and abilities as a knower. However, the concept within medical cases remains under-theorized despite quickly becoming a common term to describe this particular kind of phenomenon. In this talk, I give a definition of medical gaslighting and look at the problem it creates specifically for self-knowledge, which relies on first-person authority. I then introduce what I call disformative feedback as a way to understand how medical gaslighting works. I claim that medical gaslighting is an epistemic injustice, a particular kind of harm to someone as a knower. Drawing from Black activist Sasha Apti, medical gaslighting is the discounting and distrust of the first personal experiences of certain groups of people and their burden of self-advocacy within all different kinds of medical systems. Adi started a nonprofit organization for those with polycystic ovary syndrome, which affects 12% on average of people with ovaries in the US, yet is rarely diagnosed. Accurate diagnoses can take sufferers several decades and multiple expensive, dismissive doctor's appointments, which also lead to depression and anxiety. When medical authorities dismiss one's pain or assert that one is mentally unstable, one can begin to doubt oneself. This doubt unfairly interferes with one being able to appropriately and rightly reflect on one's own physical and mental states. This interference with one's self-knowledge is a particular kind of epistemic injustice, one that is actively perpetuated through different kinds of medical feedback. So what do I mean by medical feedback? Diagnoses, availability of resources, the kind of care and attention one receives, the autonomy one has in treatment plans all give one information about one's self and one's value and worth. Medical systems have a widespread power in terms of who is considered an expert, who is given authority, and what kinds of access one has to information and different kinds of treatment. Given the authority and decision-making power of medical systems, the feedback greatly influences that person, what they know, and how they behave. Feedback includes explicit information from one's doctor, as well as implicit feedback from structural sources, like how easily one moves through a medical system, like healthcare. While medical expertise is crucial for our well-being, the impact of medical gaslighting is severe enough that it must be taken seriously. Gaslighting was 2018's word of the year. Concepts of gaslighting may differ on conditions of intentionality, manipulation, malice, but converge on the purpose being to cause the person to question their reactions, perceptions, memories, and beliefs in such a way that leads them to doubt their mental stability or reality, particularly if their states are grounded in truth. My focus on medical gaslighting is the kind of harm it does or attempts to do to one's ability to know oneself, particularly one's bodily and psychological states and experiences. When medical gaslighting is internalized, one will no longer be able to relate to one's own experiences of the self in the same way, since the medical authority has dismissed their first person authority. When we see this dismissal occur more often in marginalized groups, such as Black women, we can look at the ways it perpetuates identity prejudice. So the role of first person authority is extremely important to us. It communicates how we're feeling, it's how we communicate, trust each other, ascribe the right to privacy and informed consent, and hold someone responsible for what they say. Epistemically, one is considered privileged in terms of accessing and reporting on one's states. Even if one is unsure of introspection and how accurate it is, our ability to self-report our states is often treated as a moral right. This authority could also be considered social, and how others reinforce one's first person authority by respecting it and listening to it in various ways. So looking at belief practices in self-knowledge, one must be able to do the following. One must be able to use one's introspective capacities to the best of one's ability. One must be able to recall accurate, not false memories. And one must be given truth-tracking concepts for recognizing, understanding, and communicating one's experiences of one's pain, mental states, and body. For this talk, I focus primarily on the first belief and how feedback can transform and distort this relationship. So feedback itself can be transformative in how it can change you. When one is developing as a child or in a new career, feedback about the self shapes who one becomes. Feedback tells you where you fit, even if inaccurate, attempting to make you conform. To some degree, you must in order to move through the world and make sense of your identity. A special dilemma arises when feedback is no longer something that the person can evaluate as a piece of fixed information because of its causal influence on the person. Such cases are difficult to evaluate because we cannot always establish a clear causal relationship between the feedback and the effects. What I call disformative feedback starts with a false or distorted evaluation of the person that attempts to control or transform that person in a way that confirms the false feedback. There are two elements of disformative feedback. It is transformative and disrupts the appropriate process of self-knowing. Disformative feedback can not only transmit false beliefs, but can distort the person's experience of themselves. The normal practice of self-knowledge is distorted because now the person distrusts their first personal authority regarding their mental and physical states, therefore also lacking autonomy in discovering and deciding what their own well-being means. An example of medical gaslighting as disformative feedback is of someone who keeps going to different doctors and being dismissed. They begin to look like a complainer. The person's behavior then seems to support the gaslighting claims of them as a complainer. As they then experience the dismissal, as well as the encouragement to self-doubt themselves, the medical systems then create seemingly accurate representations through their feedback and through the treatment of the patient. Even if not an expert in medical knowledge, the patient is still a self-knower to the extent of having privileged access and a certain authority on their experience. Too often, this dismissal can result in injury or even death, particularly Black people in labor. So let's look at how Williams is a case of unsuccessful medical gaslighting as disformative feedback. When Williams experienced a familiar pain during labor, she asked for a specific treatment based on her own medical history. The nurse reacted as if Williams was confused from the medication. When a doctor finally intervened, it was not the test nor the treatment that Williams had explicitly asked for. Luckily, she resisted medical gaslighting, the dismissal of her first personal authority, by persisting in her understanding and beliefs of her perception of pain, her mental stability, and the real threat to her body. The doctor finally did as she said, but only after trying other procedures. It helped that Williams knew exactly what kind of physical issue it was and the medical procedure that needed to be done instead. All in your head is a common phrase that women hear when reporting pain, and Williams was no exception. Someone who is famously known for her physical abilities still got feedback that she lacked first-person authority and self-knowledge. Williams' testimony failed to receive uptake from health professionals, which is considered testimonial injustice, a kind of epistemic injustice. Epistemic injustice is unwarranted or unfair harm towards an individual in their capacity as a knower, such as sharing and gaining knowledge. This ability to gain knowledge includes self-knowledge. Using disformative feedback as a concept, we can see how medical gaslighting includes this kind of epistemic injustice. Disformative feedback is often based on unjust stereotypes about group membership. While disformative feedback can and most likely does happen to everyone, epistemic injustice is characteristic of the ways in which those from stigmatized and oppressed groups are impacted by others' perspectives and treatment. Despite being a world-renowned athlete, Williams was a victim of epistemic injustice as a Black woman in her regards to her bodily experience. As an example of disformative feedback, medical gaslighting attempts to sever the relationship one has to one's own states when it's rooted in discrimination and targets certain groups to perpetuate social status and oppression. Disformative feedback, in this case, medical gaslighting, is a particular systemic epistemic injustice related to self-knowledge, given that it's systematic, oppressive, and for self-knowledge in particular, distorts the first personal authority one should have. So, to give a breakdown of the overall argument related specifically to medical gaslighting as an epistemic injustice. First, assessing feedback and forming beliefs about oneself are epistemic practices of self-knowing. Medical gaslighting distorts the epistemic practice of self-knowing and harms the person in terms of their epistemic ability and first-person authority to properly assess their experiences. Medical gaslighting systematically and disproportionately affects certain groups of people based on their identities. Epistemic injustice is a systematic harm based on identity prejudice, which is unwanted negative stereotypes about a social group and members in terms of their epistemic practices and abilities. Therefore, epistemic injustice is a form of oppression. And this occurs when certain groups of people are systematically receiving more medical gaslighting and therefore disformative feedback than others based on this identity prejudice. So we can draw from this that medical gaslighting is also considered a form of oppression. So in review, the key claims of this talk were that medical systems give a person information about themselves through medical feedback, which includes treatment decisions. In many cases, medical gaslighting then occurs, which is an attempt to cause a person to distrust their own first personal authority regarding their mental and physical states. This then also causes a lack in autonomy and the ability to seek and receive proper care. And finally, medical gaslighting is usually systematic and often unintentional, but still remains unjust because it is often based in identity prejudice and prevents certain groups of people from fair treatment. Thank you, and please feel free to reach out with any questions you might have.